Hello and welcome to the FLCC Nursing Admissions Information Session. So thrilled to have you join us to get all of your questions answered about the nursing programs here at FLCC. My name is Ann Perkowski. I am an admissions counselor here at FLCC, and I work primarily with our nursing programs. So if you have any questions that we don't get to during our time together now, please feel free to reach out. I've got my email right there, firstname.lastname@flcc.edu. All right, we're going to cover a lot of things with our time together. We're going to talk about the different pathways to pursuing your RN degree. We're going to talk about prerequisites for those pathways, application requirements, the application timeline, when and how to apply. And also we're going to talk a little bit about the cost of attendance here at FLCC. So here at FLCC, there are two ways to pursue your RN degree. The first is our traditional RN program. We have both fall and spring entry points now, which is a very exciting update we're able to offer to students. And then for those start terms, we do have different priority deadlines. For the fall entry, which would be our fall 23 term coming up, the priority deadline was February 1st. Now that is a deadline for folks who are looking to get an earlier decision. So we ask that they have their application and all their application materials in by that February 1st deadline. However, we still review applications on a rolling basis after that deadline. So if you haven't applied yet and you're still thinking about it, there is time to do so. For the spring entry, that priority deadline will be October 1st. Our traditional program, it's 2 years. Once you're admitted, it's 4 semesters total. And then it is one of our selective admissions programs, so there are going to be some prerequisites. For all students seeking entry into the traditional RN program, algebra, biology, and chemistry are all going to be prerequisites. For our students who are current high school seniors and they're seeking direct entry into the program, we are looking for an 85 or above in all of those prerequisites. The other pathway is for our students who are current LPNs. They have the option to pursue the LPN to RN accelerated option for our RN program. For those students, you do have to be a current LPN to apply. It's going to have those same priority deadlines with those same guidelines. So February 1st was our priority deadline for the fall 23 start, but we will still be reviewing applications on a rolling basis until all seats are filled for the program. The accelerated program offers students the opportunity to complete their RN licensure in a slightly accelerated timeline. So as opposed to the full 2 years, usually our LPN to RN students are looking at about 15 months to complete. And then there are, of course, some prerequisites for this track as well. So in addition to the algebra and the chemistry, our LPN to RN accelerated students will also need to have completed English 101, A&P 1, and Intro to Psychology. All right, so 2 different options for pursuing that RN degree. Let's dig in a little bit more. For that traditional track, let's go over some application requirements. So first step is always going to be completing that FLCC application. It is free and it is totally online on our website. You're just going to click that Apply Now button. You'll have to set up an account, answer some questions, and then submit your application. If you've got any questions about that, let us know. We're always happy to help walk students through that application process. The other piece that will be required for the selective admissions program is going to be your TEAS exam scores. The TEAS exam is it's a skills assessment. It is offered at a lot of different locations. We do offer it at FLCC through our Workforce Development and Career Solutions office. So we've got more information on the TEAS exam on our website, and we definitely encourage you to connect with that office as well for questions about scheduling your TEAS or study guides, anything like that. Students do need to score a 65 or above on that TEAS exam. Now, the other piece that's really important to know about that TEAS exam requirement is that students can retake the TEAS exam once if they were unsuccessful at their first attempt. However, after 2 attempts, if students are not successful, they do have to wait 2 years to retake that TEAS exam. So it is really essential to make sure that you are in a good spot for taking that TEAS exam. And if you've got any questions, please let us know. We're also looking for a minimum cumulative GPA of a 2.5 or above. When we're talking about cumulative GPA, what that means is your GPA cumulated from all schools attended at the college level. So your high school GPA would not factor into it, but if you've taken college classes at maybe a couple different schools, we are going to look at your overall GPA from all schools attended. And part of calculating that cumulative GPA is going to be having all of your official transcripts. So we will need your official transcripts from high school, any colleges you've attended, and then if you did take any AP courses during your time, we're going to need to have those transcript scores as well. Please note, it's important to remember that for the biology, or if you've completed Anatomy and Physiology 1, a grade of C or higher is required in order to be considered. So now that we've talked a little bit about what the application looks like, let's talk about what your schedule looks like. Right here, we've got a sample of the traditional schedule for our RN students. As you can see, it's that 4 semesters I mentioned earlier. And you can kind of get a sense of what the schedule is going to look like while you're with us. Please note that the nursing classes do have to be taken in the order that you see here. So you can't kind of move around the nursing classes. It's really essential that they're taken in the order set by the department. And then there will also be some general education requirements as well. Those you may have some flexibility in scheduling those, and certainly if you've had the opportunity to complete them before starting the program, that's great. Really sets you up for success there. So then it's really important to talk about that application review process. Now that we have an idea of what the schedule looks like and what the application requirements are, a lot of students just wonder what comes into play when we're talking about a selective admissions program. So right here, we've got all of the application review process. This is actually also available through the self-evaluation that's available on our website. And often if you've met with us on campus, we also share this piece. The first step in calculating what your points would look like is first your TEAS exam. So of course, below 65, that's not going to come in, so no points awarded. But then the points are awarded whether you had exemplary, advanced, or proficient performance on that exam. The next piece would be what we refer to as bonus points. So these are classes that you would have completed, and they're not your direct program prerequisites, but they are really helpful to have completed prior to start. So the bonus point classes would be AP Bio or R Bio 110. Points are awarded for a grade of B- or above. A&P 1 and 2, of course, those are great courses to have for your bonus points. Same thing, points are awarded for a B- or above. Also, if you've had the opportunity to complete Healthcare Studies 153 or HCS 154, 153 is the fundamentals of healthcare, 154 is medical terminology. There are some bonus points associated there for performances of a B- or above. And then, of course, here at FLCC, we are a community college, and our mission is to make sure that all individuals in our service area have access to education. So if you live in one of our service areas, there are some bonus points associated with that as well. If you are a veteran, first of all, thank you so much for your service. And then also, of course, that is a consideration in your application review. If you've also completed your bachelor's degree with a 2.0 or above, that also qualifies for some bonus points. So you can take a look, see where you land, and see how you are in terms of getting those classes completed. If there's anything that maybe you might want to complete in addition to anything you've already completed, that would be a great thing to look at right now. I do also like to mention at this point that our nursing program is our selective admissions program, so it's got that GPA requirement, right? We're talking about the TEAS exam. If you're looking at this and you're thinking like, I don't have maybe all my prerequisites done, or maybe my GPA needs to come up a little bit. We absolutely offer a pathway for that as well. So for our students who do have a need to complete some additional coursework, they can be accepted to our Healthcare Studies with Nursing Intent program. This is one of our general admissions programs, so you would not need to complete the TEAS before entering it. And then you're able to enroll at FLCC, complete some of those prerequisite or bonus point courses, and then prepare for applying to the nursing program. Nice bonus there is also you will be receiving academic advisement gearing you towards the nursing program. So there's a lot of different ways that you can approach applying to the nursing program that we'd like to make sure that our students are all aware of. All right, I'll pause for questions. Okay, so I'm going to continue on here to the LPN to RN accelerated option application requirements. So first of all, there's going to be that FLCC application, right? So again, it's free, it's online, it's on our website. You just want to click apply now. Similarly, you're also going to need to request all of your official transcripts. It's also important to note that official transcripts do have to come directly from the issuing institution to FLCC. Students cannot submit their official transcripts. That just does not qualify as official. So you'll definitely want to reach out to your schools and request those official transcripts be sent over to FLCC. A copy of your current LPN license, of course, your LPN transcripts, and then for students who have completed their LPN licensure prior to 2 years before their entry term, or if their school did not have ASIN accreditation, you will need to complete the NLN exam. The NLN exam is in a lot of ways the counterpart to the TEAS exam. So they're both skills assessment. It's going to be reading, writing, science, and you will need to score a 75 or above on the NLN exam to be considered for the accelerated option to the nursing program. It is important to note as well that for the NLN exam, there's only an opportunity to take it once. We do have information on how to take that exam on our website, as well as helpful links to study guides and other important information. If you've got any questions, please let us know. And then similarly, there is a minimum GPA requirement of 2.5. And now here we've got the LPN to RN sample schedule. So as I mentioned, our LPN to RN students, they do have the opportunity to complete their RN coursework in a slightly accelerated manner. So instead of doing their first full semester, they will complete a bridge semester. This sample schedule is reflecting a spring start. So for that winter session, you would be doing your bridge course and then Nursing 112 and Nursing 113. Of course, for fall start, that would be a summer session that you're completing. And then you would be ready to start with your spring semester right into the RN coursework. All right, so this is something really helpful to review, and please note both of these sample schedules are available on our website if you want to kind of take a deeper look at them. All right, so we've talked a lot about the application pathways, whether we're talking about our traditional track for nursing, whether we're talking about LPN to RN accelerated track, and then of course at Healthcare Studies with Nursing Intent. Now I'd like to just take a minute to kind of brag about our program. We've got a lot of great things to chat about here at FLCC. Probably the most exciting, most recent update is that we have received our NCLEX pass rate this year, and we're really, really pleased to share that we have a 93% pass rate. I believe that might be the highest in the region. So that is just a reflection of the incredible quality of this program. We have amazing faculty who really care about the students and make it their mission to ensure that their students, when they are ready to take that NCLEX exam, that they have everything they need to be successful. We do have a program completion rate of 62% of students within 6 semesters graduating. Which is really great. And then of course our end of program student learning outcomes, very quantitative and psychomotor measures support that students achieve all their end of program student learning outcomes. So it is a rigorous program. It is a selective admissions program, but it definitely sets students up to be successful. And another thing to brag about is our incredible Sands Family Center for Allied Health. This is our brand new 7.2 capital improvement project. If you haven't had an opportunity to visit campus, I really would like to encourage you to do so. It is incredible to see. So it is a full simulation lab. It looks just like a hospital or any other medical facility that nurses will be working in. It has all of the same technology such as Pyxis machines available for students to really practice so that they are prepared when they enter the clinical setting. We've got our debriefing room, so review student demonstrations with faculty. The students can get really good feedback and kind of see all the things that are good learning points for them. We have our HoloLens equipment, which uses virtual reality to study human anatomy. And in each of these hospital bays that we have in our simulation room, we do have our high fidelity mannequins that are able to talk and cough and react just like patients in a clinical setting would. And then also we have our science incubator, which is one of my favorite spots on campus. What I love about the incubator is that it was established because our faculty recognized that students had a need for a dedicated space to practice their science skills. So they applied for a grant, it was awarded, and now we have the science incubator. So that's a great resource, not only for a place just to study, but also there are practice testing available in the science incubator and one-on-one tutoring support. So with all of these incredible facilities, you might expect that it has a very high price tag. And I couldn't be happier to share that we pride ourselves on being one of the lowest cost institutions in the region. Currently, our current cost of attendance for a full-time in-state resident is $2,556 per semester. So that's just over $5,000 for the year. So students can complete their associate's degree for just over $10,000. And that's the sticker price. That is the total cost. That is with no financial aid, no scholarships. That is the total cost. However, about 75% of our students do receive financial aid. So for the majority of our students, that's not even what they're paying. I am a financial aid generalist, so I'm happy to share some general information about financial aid, but I definitely encourage you, if you've got specific questions, to connect with our financial aid office. They are wonderful. We can go over just the different categories of financial aid. There are 4 general categories. So first is going to be grants. That's going to be your TAP and Pell. Those are based on financial need. The biggest ones, TAP is from New York State, Pell is from the federal government. Then we also have scholarships. I encourage students to always look in their community for scholarships. But here at FLCC, we also have institutional scholarships. Those are provided through the FLCC Foundation, so they are alumni supported. And they really are across programs, different, they're sometimes for different student populations. Those scholarships do become available in the winter, so I encourage students to take a look, go on the website, see what the options are, and apply. In addition, there is work study. Work study is student employment that would be part of a student's financial aid package. So we do have student employment available across the campus. In our admissions office, we've got work study students joining us as student ambassadors, but it could be as a lab assistant or research assistant. It's a really great opportunity to work on campus and then have that financial aid piece. And then the last one would be loans. So we've got the federal direct student, the parent, private loans, all different options to help make your education even more affordable. So the pieces that you would need in order to pursue your financial aid would be just we'll go over the general applications. The first is going to be that FAFSA application. So that's your free application for federal student aid. It's a good idea to submit your FAFSA, even if you think maybe you won't qualify, because that is going to be the basis for establishing need for other scholarships. The next piece would be that New York State TAP application, and that's for that New York State grant money. And then the next one, which is why I really do encourage students to complete their FAFSA, is the Excelsior Scholarship. You may have heard of the Excelsior Scholarship. It is available in New York State. We're a SUNY school, so of course our students are eligible for the Excelsior Scholarship. It does have some additional requirements, so it's good to read the fine print on it. But it is what we refer to as a last dollar aid scholarship. So students who have submitted their FAFSA, they've received their financial aid package, and it's not quite what meets their needs, they do have the option of applying for the Excelsior Scholarship. As I said, make sure to read the additional requirements, but for a lot of students, it can be a really great option. And then, of course, there is a FLCC Foundation Scholarship that I mentioned previously through our alumni. Now, if you do have specific questions, if you would like some support completing any of these applications, I encourage you to schedule an appointment with our FAFSA specialist, Lydia. Those appointments are available online on our website, and she can answer all your questions about financial aid, walk you through the application, really whatever you need so that you can be well informed for making your next choice. All right. So I know that was a lot of information. Thank you so much for joining me. If you do have questions, because as I mentioned, lots of information, I'm sure, please reach out. So there's first of all our admissions office. So that is, I shared both our phone number and our email. We're a small team. We really are interested in informing students about everything they need to know, getting your questions answered so that you can be really confident that the next step you make is the right choice. And then if you'd like to connect with me, I've got my phone number right there, email address as well. So feel free to reach out. I would love to chat more. All right. And otherwise, thank you so much for joining us. I've really enjoyed our time together, and I look forward to chatting more soon. Have a great day. Bye.